How's it going, guys? Medium difficulty question for step 1 neuro. 46-year-old man. He's got a radial nerve injury, and we know that because he has wrist drop and a pronated arm. That in and of itself is pass level. Okay, knowing that that's a radial nerve injury, you can see it with things like mid-shaft fracture of the humerus. But in this situation, holy shit, we're showing you the brachial plexus. Real fucking annoying. So this is what's going to go down. I'm going to give you a very easy way to remember this image for USMLE. Okay, so for starters, these nerve roots on the left that are unlabeled, and this is the same image the USMLE can show you. They'll give you different variants. This is one of them. Now these lines coming off the left, where my cursor is right now at the top, that's C5, C6, C7, C8, and then T1 at the bottom. So your upper brachial plexus, C5, C6, such as if you have Herb Duchenne palsy, Waiter's tip, and then C8, T1, lower brachial plexus, Klumpke palsy, where you got the claw hand, the clenched fingers. But I'm going to tell you an easy way to remember these nerves. Now the first thing you're going to do is you're going to look at choice D, correct answer. This is the radial nerve. This is the big nerve running down the middle. You say, well, B is also running down the middle. Sure, but if they show you a three-dimensional drawing of this, you're going to see one that looks a bit thicker and larger. It's running down the middle. That's the radial nerve. So you look at that first. You identify that first. You say, okay, that's the radial nerve. The second thing you're going to do is you're going to look at this little one coming off sort of like a curvature, sort of like sideways from the radial nerve. And that's your axillary nerve. Okay, innervates the deltoids, surgical neck of humerus fracture, very buzzy for injury of that. Now, where some students get confused is depending on the drawing that you look at, sometimes they can show this little curved axillary nerve going up, going down. It doesn't fucking matter, okay? It's the fact that it's branching off the radial nerve. That's what matters. So you identify these two first. You say, oh, that's the radial nerve, the big thick middle one, and then that little one coming off, up or down, doesn't matter. That's the axillary nerve. Cool. And then your third step is the remaining ones. Just from top to bottom, you just know the order. You say musculocutaneous, median, then ulnar. That's it. Okay, so those are your main nerves right there. F is your long thoracic nerve. That innervates serratus anterior. If you have a mastectomy, for instance, you can injure that and get winged scapula. So you can be aware of it, okay? And you can say musculocutaneous nerve. That's going to be biceps function as well as sensation of lateral forearm. Median nerve, that of course can be supracondylar fracture of the humerus. They can say distal shaft fracture. Most of the muscles of the forearm and the lateral aspect, of course, the first 3.5 digits. And then your ulnar nerve, of course, that's your medial forearm, the medial 1.5 digits. It's a lot we could talk about. If you have a medial epicondylar fracture at the elbow, you get compression there, cubital tunnel syndrome. You get ulnar nerve compression at the wrist, hook of hamate fracture, guy in canal syndrome, Froment sign. I made a clip on that, I don't know, like a week ago. So that's sort of the very consolidated, easy way of approaching the brachial plexus. Okay, the big, thick middle nerve, your radial nerve, our correct answer in this case. Axillary, auxiliary is the little one coming off, up or down. And then just in order, the remaining ones, top to bottom, musculocutaneous, median, ulnar. And then sometimes you can get the long thoracic coming off closer to the nerve roots. Choice D, correct answer. You know the deal. I'm to make more content of this prevention. Appreciate your time. That's it.